Continuing our coronavirus coverage now, it's official. All Syracuse City employees will have to be vaccinated or undergo weekly COVID testing. COVID policy also requires new city employees to be vaccinated before they even start their jobs. Melanie Johnson spoke with the mayor about the move. She's working for you tonight.
There will be consequences for any City of Syracuse employee who does not follow the mayor's new COVID-19 policy. Either prove you are vaccinated or take a COVID test every week.
It's like any other workplace rule specific to safety. If it's not followed, there will be repercussions to that.
Mayor Ben Walsh in talks with labor unions right now to decide what will be the appropriate discipline if someone does not follow the new mandate. He tells me a vaccine requirement for all city workers is still a possibility.
We're seeing infection rates go up. So we need to do more, and so that's what this is about. We stopped short of a full vaccine mandate without the option of testing. It is something that's still on the table.
The city will have employees upload their vaccine cards and COVID test results to a special app.
Our hope is that this will encourage more people to get vaccinated so they don't have to go through the testing process to begin with.
Rapid testing will be done at multiple city locations with the help of Upstate. Tonight, many city employees are out of work because of COVID.
We do have over 20 people in city government, including in the police department, that are either have COVID or are out on quarantine. So this is having an impact on operations.
But not everyone is 100% on board. More than 50% of the Syracuse Police Department is not vaccinated. Some officers are pushing back against making testing a requirement and showing vaccination proof.
For a variety of reasons, there's hesitancy among police officers. Again, we understand that, but we can't let that get in the way of protecting everyone's health and safety.
The mayor's office and the police union are expected to sit down sometime next week to discuss the new requirement. The COVID-19 policy goes into effect September 7th.
Well, the surge in COVID cases across the country is having an alarming impact on children. Recent testing data shows kids are testing positive for the virus at levels we haven't seen since last winter's COVID surge. States like Mississippi and South Carolina are reporting record highs in pediatric COVID cases. The rise in child cases comes right as many kids are heading back to school, only intensifying the debate over masks should be required in the classroom. Our Connor White's live in Syracuse with more on this ongoing debate. Connor?
It's with the school year in mind that at least one family went to a pop-up clinic at that church across the street, something that won't be available to the younger students at Porter Elementary here on the other side of the road, as pediatricians are already seeing an uptick in COVID and other respiratory illnesses. 14-year-old Bobby Sweeney starts high school in September. Today he got his shot on fatherly advice, or to hear him tell it,
my dad made me come.
Because for Dad, it's a little peace of mind.
It's just another not barrier, but protection that we can provide. I mean, he wants to run and be a kid.
Vaccinated or not, most students will be in masks when school begins.
I'll be honest with you, I think the parents have more of an issue with the children wearing masks than the children themselves. The majority of the kids don't seem to mind wearing masks.
Dr. Robert Draker at Summerwood Pediatrics says those masks will be important to keep in-person learning going, seeing an uptick in COVID and other respiratory illnesses this summer after many people ditched the mask.
We're seeing more cases of COVID in the children, the majority of which have not been ill, but it has been in the younger children.
Doctors now seeing a high number of young kids with COVID, RSV, or even the flu, far earlier in the year than usual.
We have seen more children lately that have multiple infections at once. This week alone, we've had a few children who have been positive for COVID, as well as RSV and some with influenza. So co-infection of both illnesses complicates issues for us clinically.
Dr. Draker says while some children have been hospitalized, severe illness is rare, and none of his own patients have gone to the ICU, providing a stern reminder that this doesn't mean there's no risk involved.
COVID can be serious in some people. COVID also has demonstrated its ability to change with time. The more people that are infected and are unvaccinated, the greater the change that occurs in the virus. And again, children can get sick and still spread the virus to others.
Dr. Draker says even with masks in schools like this one, he and other pediatricians expect cases to continue to go up once the school year starts.
Will the New York State Assembly in Albany manage to finish its investigation into former Governor Andrew Cuomo? That investigation was originally launched to look into several scandals surrounding the former governor, including sexual harassment allegations, how he handled nursing home death information, and accusations he misused government resources to write a book. The Assembly Speaker paused the investigation when the governor announced he was resigning. Days later, he started it up again. CBS 5's Mary Keeler was the first to question him on that flip-flop.
Michael Hasty's response was that New Yorkers deserve to learn what the investigation turns up. And now, while the speaker was visiting the state fair today, I asked him to respond to Assembly members who are telling us this investigation will never be completed the way it should be. Democratic Assembly Speaker Carl Hasty touring the New York State Fair Wednesday and posing with his cardboard cutout. Assembly members from Central New York joining him at their booth inside the Center of Progress building. I went to ask him about concerns coming from the people running the impeachment investigation into the governor.
Members of the Judiciary Committee and ranking Republicans are calling the investigation happening now incomplete. They're worried that the governor never testified or never had an interview with the Assembly's firm, the Judiciary's firm. What's your comment on that?
You have to really talk to the chair of the Judiciary Committee. I'm handling this like we do an ethics investigation. I don't oversee the day-to-day operations. I've left it to the committee and to the law firm to move forward.
A couple minutes later, I wanted to press him further on the subject.
Back to the investigation, you said earlier this week, quote, I do think that
I think we need to let the investigation continue. And the lieutenant governor has now become governor. And I think we got to start looking at those things. So I think on the investigation, let's let the Judiciary Committee finish the investigation.
My question respectfully, Mr. Speaker, is though, you said, quote, I think there's a lot of ways for people to get accountability. I don't think the Assembly is the only way. What would those other ways be that the Assembly could show people the accountability?
There's 7 other people criminally investigating the governor. So I simply said, everyone's saying, well, the Assembly has to hold them accountable. That's fine. People will get those results in the report. But if there's 5 local district attorneys, a U.S. attorney, and an attorney general, that's 7 people that are looking at it.
This comes as some other members of the committee in charge of this investigation say they don't think it matters that former Governor Cuomo did not testify, and their work is almost done, adding the governor had the chance to make submissions and he chose not to.